Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. We also often address common concerns and dilemmas that come up with aging parents and other older loved ones, like what to do if you're worried about falls or safety or memory, or even the quality of an older person's healthcare. In today's episode, I am going to address a situation that I'm often asked about, which is what can be done about an unsafe older driver. Now, this is a question that is generally asked by someone who is not the older driver. And so I especially hear about this from families. So I've been asked this by spouses, by concerned adult children, but I'm also sometimes asked about this by people who are friends or neighbors or just other people in the community of an older person. And it's understandable that this is a common question because even though most older adults remain very good, competent drivers, even as they age into their 70s and 80s, and some of them even into their 90s, it's true that some of them are becoming less safe for reasons that I'll be explaining in this episode. And a fair number of those less safe older drivers are either unable or unwilling to recognize that their abilities have declined and that it might be time to make a change. So it's understandable that this is a super common situation. And in this episode, I want to give you some information and some tools and skills to better address it. So specifically, what I'm going to be covering in this video is, first of all, I'm going to start off by talking about how aging tends to affect driving abilities in general. Then I'm going to go over some of what I find to be the most common causes of unsafe driving in aging. I'm going to talk about how we can make driving safer. And then I'm going to talk for a bit about driving and Alzheimer's and dementia. So Alzheimer's and related dementias, because that is a particular situation that has its own angle to think about. I'm going to talk about when should an older adult stop driving? How do we know when it's time for them to stop? And how do we actually get somebody to stop driving, especially if they're refusing to stop or haven't followed the instructions of the DMV or their doctor? So let's get into it. So first of all, how does aging affect driving? So I think it's really important to start, first of all, by again emphasizing that just because somebody is getting older into their 70s, 80s, even 90s, that does not make them a bad driver. There are lots of older adults who remain very good, competent drivers as they get older. And so we don't want to assume that just because somebody has gotten up there in years, maybe even might look kind of frail, that they are a bad driver. To do that is really to be ageist, and it's important to avoid that. And that said, safe driving does require certain abilities. It requires vision that is adequate to monitoring the roadway, the situation around you. It requires cognitive processes to process the information that is coming in as we're driving, to make judgment calls relatively quickly. It requires reflexes to respond to unexpected situations, which come up a fair bit when we're driving. And it requires certain physical abilities. We generally want to make sure that we're able to turn our heads, look over our shoulder, check blind spots, look around well. We need to be able to grasp the steering wheel and sometimes other aspects of the car. We need to be able to manipulate the pedals. So these are all, abilities of the body and mind that can change as we get older. And in fact, just with what's considered normal aging and things tending to start working a little less well, less quickly as we get older, we do see some small declines in these abilities. Vision's not quite as good. Processing speed of the brain is not as fast as when you were younger. Reflexes, mobility will be slower as well. But in normal healthy aging, that should really be just a small decline and not enough to keep somebody from being a capable driver. So what else tends to happen as we age? Well, also, as people get older, they tend to develop other significant health problems that will affect these abilities. So it's quite common for people to have bigger declines in these abilities due to common health problems. And probably the ones that are likely to have the biggest impact on safe driving are going to be vision problems and cognitive problems that interfere with processing and judgment. So what do the statistics actually tell us about aging and driving? So the statistics are interesting because, first of all, what statistics and research have shown is that many older adults voluntarily start making modifications to their driving behaviors as they get older. So, especially as people get into their 80s, we see that many older adults are choosing to drive fewer miles than when they were younger. They are driving less at night. They are, if they're stopped or in a crash, they're much less likely to be under the influence of alcohol. They drive less at rush hour. And I think this is actually something to be celebrated because to me, this is a sign of successful aging. Because successful aging doesn't mean living just the same way as when you were younger. To me, successful aging means being able to make some appropriate adaptations as our bodies and minds get older and our abilities shift somewhat. So I love that many older adults are choosing to do this. The statistics also show that older adults do have fewer crashes per miles driven than many people who are in the younger population. However, if they do have a crash, unfortunately, older adults are more likely to be injured or even killed in a crash, and that probably reflects to a certain extent the fact that our bodies become more fragile as we get older, and so it's easier to have a bad injury when you have the shock of a car crash. The data also shows that crash rates start to increase around age 70, and some research indicates that failure to yield right of way is a common crash cause, which is not super surprising when you think about it. I mean, that requires, again, enough vision to see other vehicles coming and the kind of processing in the brain and judgment to determine, do I have time to get across now or should I wait? So now before I get into common causes of unsafe driving, I just want to talk a little bit about, what do we mean when we say unsafe driving, right? Like what exactly are we talking about? And so here I tend to think of it in, kind of three buckets. The first bucket is a sort of informal kind of gut feeling that an older person has become unsafe or is less safe than they used to be. And this comes down to, certain feelings that people might have, like, do they feel unsafe riding in the car with this older driver? Or have there been accidents, close calls, traffic tickets? So that's one form of unsafe driving. A more objective way to assess unsafe driving is to have observed some sort of specific warning signs or worry signs that indicate that the person isn't doing so well. And so one of the things you can do if you're worried about an unsafe driver is to look for one of these lists of driving warning signs online and hopefully ride with the person and see how many of these driving warning signs are happening. So let me show you one now that I often recommend to people who are in my online programs. It is from the Hartford group. I think they do, insurance. So let me show that to you. So this is a worksheet of warning signs for drivers with dementia. Now, even though they developed this for the situation of driving in the context of Alzheimer's and dementia, and I'm going to talk a little bit more about that in this episode, I think it's actually just a really good list of specific things that we can look for when we're wondering whether somebody is as good a driver as they used to be. So it includes things like difficulty turning to see when you're backing up, riding the brake, easily distracted, are other drivers often honking, incorrect signaling, difficulty parking within a defined space, hitting curbs, failure to notice important activity on the side of the road, and many more. So finding a list like this and kind of going through can, I think, really help take us from this sort of nebulous gut sense that, oh, they're not a good driver anymore, this is unsafe, to, what exactly are we observing that is problematic? And that can help clarify how important it is to intervene. And then there's what I would consider kind of the best type of assessment, a little bit, closer to, perhaps a gold standard. And that is having a fitness to drive evaluation done, preferably by somebody who has experience evaluating older drivers, because the things they might be looking out for would be different than evaluating, say somebody who's 18, just getting their license for the first time. And these can be done by the Department of Motor Vehicles. They can be done by certain occupational therapists, or sometimes there are special driving rehabilitation specialists who can do these as well. So now that we've defined unsafe driving, what are some common causes of this as people get older? So often, again, it comes down to something affecting one of the physical or mental abilities that we need to drive. So a really common cause in older adults is vision problems, because it's really common for people to develop certain chronic vision problems as they get older. Problems such as glaucoma or macular degeneration or even cataracts can all affect vision and keep somebody from driving well. Another cause would be, more broadly speaking, cognitive impairment, meaning the brain's, thinking processes and memory processes, or any aspect of the brain's thinking processes, are not working normally as one would expect for age, and that can definitely affect driving. Now, I list medications that slow thinking and reflexes as another cause. I mean, medications can be a cause of cognitive impairment, but even if somebody doesn't seem to be very visibly affected by their medications, it still might be slowing down their thinking and reflexes enough to affect their driving. Another potential cause of unsafe driving in older adults would be substance use and abuse, right? So being under the influence of alcohol or some other kind of either recreational drug or even, abuse of a prescription drug. And then it's also possible for, driving to be less safe because, again, people are having a certain kind of mobility problem that affects their head, their neck, their hands, or their feet. It could be arthritis, or it could be a nerve problem or a pain problem that is affecting them, and that can interfere with driving. Lastly, I list dementia such as Alzheimer's and other types of dementia. So this, is a form and a cause of cognitive impairment. This is a condition where, we have a permanent condition that has affected the brain and is interfering with its ability to think the way it used to, and is not going to get better over time, is actually really likely to slowly get worse over time. So those are the things that I consider the most common causes of unsafe driving in older adults and as people get older. And then there are some less common causes of unsafe driving that I also want to mention. These are some causes that are worth considering. I just find that they're a little less likely to be the cause of unsafe driving in many of the older adults that are brought to my attention. So first of all, any condition that causes something that we call syncope in medical terms, which is basically a fancy word for passing out. And there are lots of medical conditions, many of them related to the heart or blood pressure, sometimes related to brain conditions or neurological conditions that can cause people to fairly suddenly pass out. And that, of course, can be very dangerous for driving. So for instance, certain cardiac arrhythmias, abnormal rhythms of the heart. So if people have a condition where their heart starts to go really, really, really fast and their blood pressure drops, that could be it. Or sometimes if their heart gets really, 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 really slow, that could do it as well. Now, the most common probably cardiac arrhythmia in older adults is atrial fibrillation. That in of itself is not so likely to cause syncope and passing out while people are driving, but there are some other conditions that could do this. Another condition that can cause people, to pass out in a way or become, unconscious would be something related to seizures, or epilepsy. Another condition to be mindful of would be severe hypoglycemia, so severe low blood sugar. So if a person is diabetic and has been on medications and has been having episodes where their blood sugar gets so low that they get very woozy or pass out, if that were to affect them during driving, that could be very unsafe as well. And then there are what we call transient ischemic attacks. So they're sometimes referred to as little mini strokes. Those can also cause people's brains or movements to stop working temporarily. So I find that these are less common causes, but I wanted to mention them as well. So given that, how can we make driving safer in aging? And here I think of it as, again, two buckets. One is, we can try to address the health and medical side of things, right? To address those common health problems and conditions that can affect driving. And then there's a kind of non-medical side. So on the medical side, what are our options for making driving safer in aging? So first and foremost, I would say identifying and correcting vision problems whenever possible is really, really important. Next, I recommend avoiding medications and other substances that affect reflexes and brain function. And if you want to know more about which medications do that, I have a video about 4 types of medication that affect memory. They all just generally slow brain function. And so to make driving as safe as possible, minimizing use of those medications can be really helpful, or certainly minimizing them during the day or during whatever time an older person is driving. It's also important to maintain strength and especially flexibility, again, in those parts of the body that we really rely on when it comes to driving: head, neck, hands, feet and legs. It's also really helpful to have enough mobility to comfortably get in and out of the car, even though that doesn't necessarily affect how well one drives once one is in the car. So, for an older person who might be having difficulty with this, could they get physical therapy to help with that mobility? Do they need better pain management of some type, and perhaps less with medications and maybe some other modalities, right? Such as, massage, acupuncture. There are other, modalities that can help with pain management that don't involve medications as much, just because many medications that work for pain also slow down the brain and probably affect driving. There's often a sticker on the prescription bottle that says to not operate heavy machinery when you're on that medication. And then lastly, it's especially if there are any signs of difficulty with memory or thinking, it's to get that evaluated. And if you're not sure, what's involved in that, I also have a video about that covers 10 common causes. There are many things other than a dementia such as Alzheimer's that can cause memory and thinking to be affected. And it's really important to keep driving safe, that if an older adult starts to seem to have a problem with their thinking processes, with their memory, that they get evaluated so that we make sure it's not due to a medication or to something else that we might be able to treat or manage. And then in the non-medical side of things, some ideas that come to my mind, one is, again, making driving less challenging, right? So adopting some of those modifications that we know many older adults are already voluntarily of their own idea starting to do. Driving shorter distances, staying in familiar areas, minimizing nighttime driving, things like that. And then another option that's becoming increasingly more available in recent years, and I'm very optimistic about this option taking off over coming years, is to drive a vehicle that has more advanced sensors and safety features. So some of the newer vehicles right now have really cool, sensors that can alert the driver. Well, they can alert the driver to being, close to other objects, sometimes people, sometimes as you're parking. Some cars can, help a lot with the parking. They can, tell if you're drifting out of the lane. They can generate a lot of alerts. So I think that's all really exciting, actually, as a way to make it a little bit safer for people to drive as they get older, and really to make it safer for all of us to drive, right, in a way that protects us. Let me now say a few words about driving and Alzheimer's disease and also related dementias, because, again, Alzheimer's is the most common underlying cause of dementia, but there are other causes of dementia. And actually, as people get into their late 80s and beyond, what's most common is for them to have mixed dementia, a combination of Alzheimer's disease and also vascular disease. And if you'd like to learn more about that, I have a video on types of dementia that goes into that. So what if the older person does seem to have Alzheimer's or another dementia, or maybe they've been diagnosed with mild cognitive impairment? What does that mean for their driving? And the answer to this is that it really depends on how bad the cognitive symptoms are. So how far along they are in terms of having difficulty with executive function, with insight, with judgment, with processing of information, with also spatial awareness and keeping track of where they are and finding their way. So it'll depend on that. And also on, when we look at those driving warning signs, how bad is the driving? So it's important to know that in of itself, a diagnosis of early Alzheimer's or another type of dementia does not usually mean that people have to stop driving. Because usually when people get that diagnosis and are told they are in the very early stage, their driving skills have not yet deteriorated to the point where it seems justifiable to take away their license or really insist that they stop. That said, they generally are not driving as well as they did before. And so research and studies have sort of found that people with early dementia often can still pass driving tests, but don't do as well when they're observed in their driving performance as people who don't have dementia. So basically, we consider them to be at intermediate risk. And what we're supposed to do as health providers, to discuss it with them, is to say, this is, again, assuming that, there haven't been a lot of driving warning signs, right? And that their thinking skills otherwise don't seem wildly disabled at that point. But what we can do is tell them, well, you seem to be you're likely going to be at intermediate risk right now. You're at higher risk than you were before. And so if you choose to keep driving, please, be careful. And also, ideally, people with early dementia would plan to transition out of driving at some point in the coming months or, a year or two, or at least to monitor their driving, to be prepared to stop when it gets worse. That would be the ideal approach. And then once they have, what we would call moderate dementia, so more significant signs of difficulty with their thinking skills and their memory, those people generally are at high risk. And if we observe them driving, they're showing a lot of those driving warning signs. They're making a lot of mistakes. They've now become high risk. And at this point, it's generally appropriate for the health provider to make a recommendation that they stop. If they do go to the DMV and get a driving test, they will often fail. And in some states, they can even be reported to the DMV at that point. So that's how it's supposed to work. Now, in reality, it often doesn't work out quite that way. Not all health providers have experience in evaluating people with dementia for their driving abilities or are familiar with the general criteria that we should use. The other thing to know about this is that many people with dementia will be very poor judges of their driving. People in general, of all ages, often overestimate their driving abilities, feel like they're good drivers and better than average, even though presumably most of us are about average. But especially when it comes to conditions such as Alzheimer's and related dementias, it's very, very common for the parts of the brain that, manage that kind of insight and judgment into how we're doing to be affected quite, quite early. And so many people with dementia are going to be very poor judges of their driving. So if you have someone in your life who has a diagnosis of Alzheimer's or dementia, or you suspect might have it, and they're insisting that their driving is fine when you're pretty sure it's not, I'm not surprised. It's a common situation. It's definitely a hard situation, but it's just the nature of that type of dementia, or it's the nature of dementia in general, that people often lose insight into their difficulties fairly early on and might even be very defensive about it when you bring it up. So people with dementia are eventually going to need to stop driving because the nature of dementia is that it slowly gets worse over time, and their driving abilities will slowly get worse to the point where the risk to themselves and other people is just too high. So they are going to need to stop driving, but many of them will never understand why or agree. And that's just something to keep in mind if you are in this situation. And I will talk more about what can be done in that case in a moment. So how do we know when it's time for an older person to stop driving in aging? So here I actually, again, think in a few buckets. And first of all, I think it's important to acknowledge that there are temporary situations. So when we might suggest that an older person stop driving. So temporary situations would be when a person is being affected by substances. So maybe they need to be on some brain-slowing medications right now to manage their pain, or another health condition. Maybe right now they've been drinking more than usual. So this might be a time where we might want them to stop driving and can envision that they could eventually resume driving if their conditions improve. And then another temporary situation that I see a fair amount is when an older adult develops delirium, especially during a hospitalization or after a surgery or from another severe illness. So delirium is this condition of worse than usual mental function that is brought on by a severe illness or severe physical stressor. It's really common in older adults. So if you've ever seen an older person get hospitalized and become completely loopy, confused, hallucinating, raving, or even like super, super quiet and spaced out, that is also a form of delirium. That is delirium. And many people, once they are recovering from the illness or the anesthesia, will start to get better. It can take days, it can take weeks, sometimes it even takes months. But that would be another time where maybe people aren't well enough to manage the demands of driving, but they might eventually get better. So those are some of the temporary situations that I think of. And then there are sort of more permanent situations that indicate that the person is probably going to have to permanently give up driving. And the things that I think about is, one, if there are enough signs of unsafe driving and they're, or if they fail an on-road driving test and we're not able to improve their abilities by sort of adjusting their vision or their, mobility or medications, And then especially if they're diagnosed with some kind of condition that has permanently altered their ability to manage the cognitive processes that are required for driving, such as Alzheimer's or another dementia, and if the doctor recommends stopping. So one situation that I didn't put on the slide, but that I know has also come up for a lot of families would be after something like a stroke, a major injury to the brain. And there I would say it really depends on how affected the person is by the stroke and how they're doing in terms of recovering abilities. And people who specialize in stroke would probably be able to support that family and patient in understanding how likely it is that they'll be able to resume driving at some point or not. So now, how do you get help if you're concerned about unsafe driving? What should you do? So before you actually ask somebody else to help you, there are a couple of things that you can do as a concerned family member, friend, neighbor, community member. And here are the things I recommend. So first of all, I really recommend starting off by exploring with the older person their perspective on their driving and your concerns. And for this, we really want to be we want to go in with a learning stance. So we don't want to go in with a stance of we're going to let them know their driving is unsafe and tell them they need to stop, but really be curious, like, oh, how do they see this, right? Have they noticed any changes in their driving? Are they worried about anything? Are they thinking they might need to change what they're doing? Are they worrying that somebody might take away their keys? Understanding this can be really, really helpful in later on making a plan for how we might support the older person in either continuing to drive or transitioning out of driving. So I really recommend spending some time just thinking, how do they see this? I mean, if you're seeing lots of driving warning signs and they're completely unaware of it, that is an important thing to know, or maybe they have noticed and they're worrying about it, and that would be useful to know too. Next, I really, again, recommend collecting some objective information. It's really going to help the doctor or anyone else you approach if you can name some specific things that you've seen them doing wrong, especially if it's happening repeatedly or consistently. So assuming you feel comfortable, if you can ride with the person and document some warning signs, that's going to be really, really useful. And then after that, I think, it's time to start reaching out to some others to try to get, some support and assistance in evaluating the person's driving and making a determination of whether they should still be driving or not. So some of your options include, first of all, I highly recommend letting the older person's doctor know about your concerns. They should know so that they can sort of do their part of checking for medical conditions that might be involved. And also because doctors can often play a very powerful role in making a recommendation to an older person and to the family about how much risk driving poses and whether they want to recommend stopping driving or not. Another option is that in many states, it's possible to report an older person to the DMV. Some states also allow physicians to report certain health conditions, such as seizures or even a diagnosis of dementia, to the DMV, and then they might have their processes for calling the person in to assess them further. So definitely look up, the rules for your state, motor vehicle department, and what are the rules about reporting an unsafe person who might be unsafe due to, medical problems. And then another option, I don't find a lot of older adults agreeing to this, but some of them will, is proposing an assessment by a driver rehabilitation specialist or an occupational therapist or, somebody who's qualified to assess the older person. There are even some specialized ones who can help the older person work on some strategies and techniques for improving their driving as well. So those are the things we can do. But what you should know is that often we are going to find that people we're concerned about fall into what I think of as like the risky in-between stage of driving, meaning that for various reasons, some older adults will go through a stage where their driving is, again, at what we call intermediate risk. So it's higher risk than it was before. It's often higher risk than we, the people who care about them, are comfortable with. But it's not yet bad enough that they, will lose their license at the DMV or that the doctors feel justified in really firmly recommending that they stop driving. So often for us as physicians, if one of our patients strikes us as intermediate risk for driving, we'll recommend that they can, consider driving less or make a transition to stopping, start planning for that transition. But, there's saying, well, it'd be better if you didn't drive too much versus like you really, it's really unsafe, I'm going to recommend you stop driving. To tell someone to really stop can feel like a big step for some health providers, and often they're only willing to take it once things have obviously gone very, very bad. So this is a hard stage to be in if you care about the person, for sure. But one of the things you can remind yourself is that often when it comes to older adults, there is going to be this trade-off and tension between autonomy and safety. The things that are safer to do often cost older adults a certain feeling of autonomy and independence. And that feeling of autonomy is really important to all of us. I think we just take it for granted when we are earlier in life. But for older adults, it's often something that they're kind of confronting. So remember that for them, they're often prioritizing autonomy over safety. And one of the things that we can do to support them in their aging journey is accept sometimes when they're choosing a little bit more autonomy over, let's say a mild to moderate safety risk. Once the safety risk gets really high, then we might have to reassess things. Now, what if they actually have reached the point where they should stop driving? They failed their driving test at the DMV and they're supposed to stop, but they are refusing to stop. What are your options at that time? Well, so one thing that I always want families to know is that if a person's license has been revoked, or sometimes just if their doctor has put it in writing that they need to stop driving, it can actually be very dangerous for older adults to continue driving. And that's because, first of all, there's a significant risk of harm to themselves when they're driving and to other passengers in the car. There's also can be a significant risk of harm to other people on the roadway, right? Pedestrians, other motorists. And there can be a lot of financial risk because insurance may not cover the cost of accidents if a driver is unlicensed. And of course, who is especially likely to refuse to stop driving when they lose their license? It's especially people who have Alzheimer's or another form of dementia, because again, they've lost that insight and judgment, and they've lost the ability to understand or remember that they are supposed to stop driving. So how do we, if someone's supposed to stop driving, how do we transition them to no longer driving? So here are a few suggestions just for older adults in general. So one thing that I recommend is to really think about holding space for difficult feelings. And I think we need to acknowledge that this is a loss to no longer be able to drive or to lose your license. It's really normal to feel strong feelings like anger, frustration, sadness, grief. And some people will even lash out at other family members or at their health providers who were involved in them stopping because they're so disappointed and frustrated by this change in their life. So how do we hold space? First of all, by just allowing the older person to share these feelings and not trying to explain them away or defend ourselves right away. If our response is, yes, but your vision got so bad, we're not being empathetic, we're offering an explanation. And that's not really what people need at a time like this. So I recommend minimizing explanations, maximizing empathy and validation, telling them you're sorry, it's hard, you wish things were different, and just being there with fewer explanations. That can really, I think, go a long way towards supporting people in this transition. Next, also very important, is to help them find other ways to get around. Driving is often something, an important skill set that we use because we want to go places that matter to us, to go socialize, to go partake in activities that we enjoy or that give us purpose or that contribute to our identity. So there are often alternate ways to get around. They may not feel as convenient as driving, but they are there. And so helping the older person think through those places that they want to go and arranging for other ways for them to get there can be also very helpful. And then, separate from helping them get to where they want to go, what are other ways that we can help this person feel a sense of agency, autonomy, and independence? That can also help ease that transition to not driving. Now, coming back to people who may have Alzheimer's or related dementia and who are supposed to stop driving. So again, many of them are going to have difficulty stopping driving. What do we do? So here again, I think it's really important to try to understand their perspective on their driving, even if they're forgetting lots of things, or that their judgment is poor. And, spending some time going into it with that curiosity. Do they have any awareness of the problems they're having when they're driving. Are they feeling defensive about it? Are they very worried about like losing the keys? What, matters most to them about this? I think that's like really important to still explore. And really what can be very helpful for us as health providers to know is how much insight does this older person have into their driving situation. And then once they actually lose their license or the doctors say it's time to, definitely stop driving, we want to involve them in transitioning out of driving if they are able to do so, if they're able to talk about it without getting like really, really upset about it, if they're, kind of able to cooperate somewhat. But even if they agree to stop driving, it's very common for people like this to then either change their mind or forget that they were supposed to stop driving. So don't be surprised if that happens, because it's very, very common. And so what that means is that you may need to intervene, especially if they're not agreeing. If they're not agreeing, you may need to intervene, and there are various ways to do that. I won't go into them right now, but it's something that I cover in my Helping Older Parents with Memory Loss course. And there are other resources online that can help you with this. But mostly you should realize that it's often not super easy to get people with Alzheimer's to stop driving, because if they agree, they can often change their mind or forget that they agreed. And then many of them just won't agree. They will have difficulty understanding why it's necessary. And in that case, we can't always wait for them to agree. We might have to just intervene a little bit more. So given all that, I want to wrap up just by sharing my approach when I'm told that, one of my patients or that somebody, might be an unsafe driver and being asked what to do. So the things I want to know: what driving warning signs have been observed? Are there other signs or any signs of cognitive impairment that like thinking processes or memory are affected? Because I'm sort of wondering, could we be dealing with, an Alzheimer's dementia situation, especially if the person doesn't already have a diagnosis? Or if they have a diagnosis, I want to know. If the diagnosis is mild cognitive impairment, I still want to know. In principle, mild cognitive impairment means you have some objective signs of a change in memory or some other aspect of thinking, but it's not yet bad enough to interfere with daily life functions. So if somebody's memory or thinking has gotten bad enough to interfere with their driving and they could previously drive, that by definition means they no longer meet the criteria for mild cognitive impairment, actually. But I certainly have encountered people who carry the diagnosis of mild cognitive impairment and actually to me seem to be much worse. So I always want to know about that diagnosis as well. I want to know what is the older person's perspective on their driving abilities and on potentially giving up driving. I like to sort of find out from an older person, like, when were they thinking they might have to stop driving at some point in their life? Under what circumstances, right? If not now, when either given their understanding of their current health conditions, or when do they think older adults should stop driving in general? I try to check into those medical factors that I referred to. Which medical factors are contributing? Do we have a vision issue contributing, mobility, medication, cognitive issue? Because I'm thinking about what can we correct or treat? Because again, we want to support older adults in driving for as long as possible. And lastly, I think, are there grounds at this point to say to the person to make a really strong recommendation that they stop driving or to report them to the DMV? So to recap what I've shared in this episode, again, most older adults continue to drive safely as they age into their 70s and 80s, some of them even into their 90s. And to do this, maintaining adequate vision, cognition, and mobility is key. And it can also be helpful to modify driving behaviors. To keep driving safely, I recommend correcting and treating any vision problems, being careful about medications that affect brain function, and otherwise trying to maintain good cognitive health. I have a video about that as well. Avoid driving under the influence of substances such as alcohol, possibly even cannabis. We know less about that, but it also seems like something that generally slows people's brains, so I wouldn't recommend it for driving. And if you can afford it, consider using cars with these newer safety features. If you are somebody who's worried about an unsafe older driver, think about whether you can explore their perspective on their driving, get a sense of, what's their take on the situation. Check for driving warning signs using that worksheet from the Hartford or another one that you can find online. Ask yourself, are there signs of cognitive impairment, other signs that something might be off with their memory or thinking? And if so, have they been evaluated or diagnosed? And then let doctors know what you're observing. And if you're really worried, you could consider reporting in many states directly to the DMV or otherwise trying to encourage or force, depending on the situation, some kind of fitness to drive evaluation. If you are dealing with somebody who has a diagnosis of Alzheimer's or related dementia, or you suspect might have this, realize that in the early stage, driving is often considered to be at intermediate risk, which means they're at higher risk than they were before, than somebody who's cognitively normal, but it's not yet bad enough to revoke their license. But as dementia progresses, they will need to stop driving. And people with dementia often do have difficulty stopping driving. So it can be a process to go through that. And I recommend getting additional support if you're in that situation. If they agree, they often will forget or change their mind. And if they've lost insight into their driving difficulties and can't understand, they will often never understand and basically always refuse to stop or never agree to stop. So if they've lost their license, you may need to intervene without their agreement. And in closing, I just want to say, I really believe it's my goal, and I believe as a society, it should be our goal to support older adults in driving for as long as possible. It's a great way to get around. I mean, yes, our society is probably too car-centric, but there are just lots of advantages to driving, and it's an important part of one's identity as an adult for many of us. And so it's reasonable to tolerate at least, a little increase in driving risk to provide older adults with more independence and autonomy. But when there are too many driving warning signs or the license is revoked, it's important to help a person stop driving, even if they're not able to agree. So with that, thank you so much for watching this episode. And if you found this video podcast helpful, if you're here on YouTube, please go ahead and subscribe as it helps more people find the channel. And if you're someone who's trying to figure out how to help an aging parent, then I want you to know that for quite a long time, I've had a special interest in supporting people just like you. And so over the past years, I've created a variety of helping older parents resources and trainings. And I also have a book called When Your Aging Parent Needs Help. So if you would like to get more useful information about how to care for aging parents, including my free online trainings, please visit betterhealthwhileaging.net-helping-older-parents. Last but not least, if you've been listening to the audio version on the podcast feed, I hope you'll come and take a look at the video if you have a chance, so that you can see my key points being displayed on the screen. So thank you once again, and I look forward to seeing you all again on a future episode of the Better Health While Aging video podcast.